Most people see a chest X-ray as just a ghost-like image of bones and shadows. But to a trained eye, it's a detailed map of human health. When you have a persistent cough or a fever that won't break, the answer is often hidden right here in the lungs. Today, we're going to look at one of the most common, yet dangerous, lung infections, pneumonia. I'm going to show you exactly how it hides, what consolidation really looks like, and the subtle signs that even doctors sometimes miss. To understand pneumonia, we first need to understand how X-rays work. Think of an X-ray like a powerful flashlight. Air is like a clear window. The radiation goes right through it, hitting the detector and making the lungs look black on the image. That's a healthy lung, full of oxygen. Bone, on the other hand, is like a brick wall. It blocks the radiation, appearing bright white. But what happens when the lung isn't full of air? What if it's full of fluid? In radiology, we call this radiopacity. This contrast between black and white is the foundation of every diagnosis we make. Pneumonia isn't just a simple spot on a screen. It's a biological battle. When bacteria or viruses invade, your tiny air sacs, the alveoli, fill with pus, proteins, and white blood cells. On an X-ray, this replacement of air with fluid creates what we call consolidation. Look at this right lung. Notice that blurry white cloud-like area? That isn't bone, and it definitely isn't healthy air. It's the infection taking over a specific territory. Notice how the edges are fuzzy, almost like a torn cotton ball. This is the first big red flag for a radiologist. Depending on where this cloud is located, we can tell exactly which part of the lung is struggling. If the cloud is at the bottom, it might be hiding the diaphragm. If it's in the middle, it might blur the edges of the heart. This brings us to a critical concept, the silhouette sign. If two objects of the same density touch each other, their borders disappear. If you can't see the edge of the heart, the pneumonia is right next to it. Now, let's look at a sign that proves you're looking at pneumonia and not something else. Look closely inside that white cloud. Do you see those dark, thin branching lines? Those are called air bronchograms. They are a classic high-level radiology sign. This happens because while the tiny air sacs are drowned in fluid, the larger airways, the bronchi, might still have some air inside them. Seeing these dark tunnels inside a white cloud is almost a smoking gun for pneumonia. It tells us the infection is deep within the lung tissue. This level of detail is vital because it helps us differentiate pneumonia from other issues, like a collapsed lung or a tumor. In a collapsed lung, everything is pulled together, shifting the heart and the trachea. In pneumonia, the anatomy usually stays right where it belongs, but the air is simply gone, replaced by the weight of the infection. However, being a professional means knowing when the image is lying to you. There are imposters that can look exactly like pneumonia to an untrained eye. For example, consider the inspiration of the patient. If a patient doesn't take a deep enough breath during the X-ray, the lung tissue becomes crowded, making it look whiter and fake infectious. Then there is rotation. If the patient is slightly turned to the left or right, one lung will appear more opaque than the other, creating a false positive for an infection. We also have to watch out for pleural effusion, which is fluid outside the lung in the chest cavity. This fluid follows gravity, usually sitting at the very bottom and creating a sharp, curved line known as the meniscus sign. Distinguishing between fluid inside the lung pneumonia and fluid outside the lung effusion is critical as the treatment for each is completely different. One requires antibiotics, the other might require a needle to drain the chest. Finally, we must remember the most important rule in medicine. We don't treat an X-ray, we treat a human being. A radiologist always looks for clinical correlation. An X-ray might look slightly blurry, But if the patient has a 103-degree fever and a productive cough, that blurriness is pneumonia until proven otherwise. Interestingly, an X-ray can lag behind reality. A person might feel terrible today, but the X-ray could look clear for the first 24 hours. Conversely, as you get better, those white clouds can take weeks to disappear from the film, even if you feel 100% recovered. Today, artificial intelligence is helping us catch these signs faster than ever, but the human eye and the clinical context remain the gold standard. If you found this deep dive into medical imaging fascinating, hit the like button and subscribe. In our next video, we'll compare a chest X-ray with a CT scan to see which one is truly the king of diagnosis. Thanks for watching.